Good evening. Tonight I'm going to be explaining the common injuries in collegiate wrestling. My name is Patrick Watson, and this is for Kinesiology 353, Care and Prevention of Athletic Injury. One of the first most common injuries that we see in collegiate style wrestling is what is known as cauliflower ear, or medically auricular hematoma. This is traumatic damage to the ear, mainly the outer ear, and causes a blockage of blood flow in the cartilage and can result in a shaping of the ear that is similar to the head of a cauliflower. Here is one of my most favorite MMA style wrestlers. His name is Randy Couture. He's also an actor. You've probably seen him in Expendables 1, 2, and 3. Anyway, as you see here on the outside of the ear, we have this damage here, and it makes it look like it's a head of cauliflower. It's kind of all swollen, and this is actually permanent damage. The common causes for cauliflower ear are either blunt force trauma, where the victim's ear is either slammed against the mat or struck by the opposing wrestler's hand or head, causing the hematoma to develop. The second most common is that of friction injuries, and we see that here with these two wrestlers. Down here we have one wrestler that had their head into the mat, and if they turn their head to the side just a little bit, they'll be getting that ear to get onto the mat, causing a friction burn. And repeated friction burns like that can cause damage and cause the inflammation. So here we have the anatomy of the outer ear. Normally your ear is composed of the helix, the antihelix, the tragus, and the lobule for the outside ear. Basically, this injury occurs in the antihelix here, and as you can see in the slide, it's right there, right above the superior to the ear canal. There are really no specialized tests for cauliflower ear. However, it is easy to identify, as you saw in the picture of Mr. Couture, and us also in this photo here. Basically, what develops is swelling, and really the test that you would have to do would basically be a pain scale to see how much damage is caused. And then again, palpitation of the ear to see if you can feel the fluid build up in there. Treatment for this injury is very, very simple, very easy. Basically, all you would do is drain or aspirate the swelling and the fluid buildup, and then after that, bandage the ear. Normally, they say to have a little bit of rest and relaxation afterwards. Normally, a couple of days rest after the injury to not have any infection set in. Okay, next up we have what is known as prepatellar bursitis. And what this is an inflammation of the prepatella bursa, or the sac that is located anterior to the patella in the knee. As we can see in this image here, you have your femur, your tibia, and then the quadriceps tendon that is connected here down to the tibia. And right in front of the patella and here in between the tendon is a little sac, and we see that sac can become inflamed as such. And what this does is it causes excessive fluid buildup of the knee. And this is normally caused when a wrestler goes to strike an opponent. And as you can see here, this is done with either a double or a single leg takedown. If you notice here in the two images, both wrestlers are on their knees, and repeated striking of those knees into the mat, especially without knee gear, without knee pads, can develop into that prepatellar bursitis. Basically, as we look at the structure of the knee, you have your femur and your tibia, you have your patella here, and then in front of that is that prepatellar bursa, and that is what can become inflamed. You have your patella that sits anterior to the femur in the patellofemoral groove and is superior to the tibia. Both of it's mostly a superficial wound or a superficial injury. Um, Basically, the kind of assessment that we would also look for here would be examination of the patient's gait and also a physical examination of the knee to check for other damage. Um, Again, you can do a simple x-ray with this. However, it's not really needed because, again, this is a superficial wound. Treatment for this injury as well would be aspiration of the bursa and injection of a corticosteroid to prevent further inflammation from occurring. Um, then at home, you can use NSAIDs, RICE, which is rest, ice, compression, elevation, and that'll also help to reduce the swelling. However, in some cases, it gets worse, and if needed, then you have to have surgical intervention, and a patient can either undergo what is known as arthroscopic or open bursectomy, and what that is a removal of the bursa from the knee. However, this can lead to complications such as sepsis and infection, and then, of course, those are other complications associated with that. Next up, we have what is known as ligament injuries. However, we're not dealing with the anterior cruciate or posterior cruciate ligaments that are the two that cross inside the knee. We're dealing with the two that are on the outside of the knee, the medial and lateral collateral ligaments, basically the inside and the outside of the knee. Many of these injuries are basically caused by a toroidal tear when the body is twisted away from the midline. And again, these can also occur in either a striking or a defending opponent, depends on where the resistance is applied to. There are 3 types of severity to the collateral ligament tears. Here I show severity of the medial collateral ligament, and what you have here is a grade 1 tear, which is just minimal damage. Usually this is commonly treated with a little bit of rice, a little bit of relaxation, and some NSAIDs again. You can have a grade 2 tear, which is just a partial tear, and again, this can be treated with rice and with the NSAIDs, and more time off of the injury to develop from what is known as a grade 3, which is the most severe, which is a complete tear of the leg. Here it looks like this patient might actually be suffering from a grade 3 MCL injury. Again, as I said, these are usually caused by some kind of force pushing the knee either medial or lateral, depending upon which way the injury is occurring. Normally, it's more common for us to see MCL tears over LCL tears because there is more structure on the outside of the knee, and with that lateral collateral ligament, we'd look if we damage that, we'd also be damaging some other structures, maybe the epiphyseal head of the femur, one of the epicondyles. There's also the menisci out there. Here in this slide, I just show you a few of the different types of injuries that can occur, or a few of the different ways the injuries can occur. As you can see in each one of these photos, we have legs being twisted in some form of direction, and it's, obviously that can result in a tear. Again, here is an anatomy of the knee, and basically with this knee, what we're looking at is you have the lateral and medial collateral ligaments, then you have your anterior and posterior cruciate ligaments, you have your femur, your lateral and medial epicondyles, your tibia, and then your fibula. And we're looking mostly at the lateral and medial collateral ligaments, as I stated before. Obviously, these injuries will occur on the lateral or medial side, depending upon where it occurs, and are going to be either lateral or medial to the bone and also to the midline of the body. What these two joints or these two ligaments provide is stabilization of the knee joint. Assessment and treatment. The best way to assess for this would be through the use of an MRI or magnetic resonance imaging, and however this can be rather expensive. So of course we would first begin with physical examination of the knee and then use either an x-ray to determine if there is any damage, and if we do notice damage, then we would proceed on to either a CAT scan or the MRI. And after you could do a physical examination, you could do a gait if the patient is able to withstand the gait. Obviously, if they're not, we're going to probably just go and do an MRI. Usually for a grade 1 or 2 sprain, surgery is not required. However, they will be put in a brace. We will do the RICE, the rest, ice, compression, elevation, and physical therapy so we can conduct some knee strengthening exercises, such as knee extensions, resistance band, flexion of the knee. Next, if we do have a grade 3, that is going to require surgery, and it's usually a graft, and it's done arthroscopically. Here I show a few of the different non-surgical and surgical interventions. Of course, this is your high-end knee brace that will offer the compression and will offer rehabilitative services for the knee as you do the physical therapy. And then again, we have arthroscopic surgery if the knee is in a grade 3 tear or even possibly a severe grade 2 tear. And what they would do is they would graft in a lateral collateral ligament, or they would graft in a ligament, normally from a cadaver, and have that surgically implanted. Well, that concludes my presentation. If you would like to discuss any more on these injuries or anything associated with collegiate style wrestling, please feel free to contact me at the 2 addresses listed below or via phone. And just thank you for everything, and have a wonderful day.